Dr. Smith, maybe you can first describe your role in testing the Pfizer shot for kids.
Yeah, so good morning, everyone. I'm a pediatric infectious disease doctor here at Duke University, and I'm a co-investigator for the Pfizer pediatric studies of the vaccine. So here at Duke, we first were involved in the phase 1 trials with several other sites across the country to find what is the right dose that is safest for kids and gives a good immune response. And right now we are part of tens of sites across the country that are testing the vaccine in children as young as 6 months.
And Dr. Smith, just tell us, you contributed to this story that Riley wrote for today's Big Take. Very fascinating stuff. What concerns you most about sort of the vaccine campaign that we are seeing for younger kids? I mean, what concerns you most?
Well, I think there are a couple of things that are concerning. First of all, it would be great to see more kids who are 12 and up vaccinated. So that would be helpful. The other thing is, well, actually, one thing I want to say is we're talking about back to school here. It's important that we all continue to mask for children who can't be vaccinated. And I think the key message to get out to parents is this is a safe vaccine. While the 12 to 17-year-old group was the youngest to be added, you're talking about a vaccine that's been given to, hundreds of millions of people. At least more than 150 million Americans have been vaccinated. And it's a safe, effective vaccine. And that's the key message to get out there.
Riley, when you were doing this reporting, what was some of the most stunning news that you found coming out of this? And what are some of the biggest things you've learned about why children are not getting vaccinated?
Yeah, I mean, great question. And to add on to what Dr. Smith just said, the fact that we're seeing only 43% of those 12 to 17 get their first dose is a really astounding number. It's the lowest uptake among all cohorts who are currently eligible for vaccination. One thing we're noting is that the hesitancy here is falling along red and blue lines in the same way it has for adults. And that might be obvious to some. Parents are clearly a part of the process. If there's hesitancy among adults, that might affect their child's ability to get vaccinated. But this is a really important subject as kids go back to school this very month. They're going to be in settings around many others, and we're concerned about community spread as Delta surges across the country.
Absolutely. And Dr. Smith, just to bring you back in here, I mean, we mentioned this at the top. I remember being in school and you have to get vaccines for a lot of different things before going into school. Why is it that COVID has become so divisive in some ways in order to get kids back in school? I'm curious what you're hearing from some parents.
Yeah, well, I think the big thing, and again, just to be clear, I'm not a legal scholar by any means, and kind of what can be mandated for school and what can't be. I think the big issue for this vaccine, particularly about why it's not mandated for schools, is that it doesn't have full FDA approval. Now, that said, private employers can certainly mandate vaccine. For those of us in healthcare, I'm a pediatrician. Duke University does require that employees get vaccine. So I think the issue around the mandate is more related to the fact that there's no formal FDA approval. And this whole COVID thing, as Riley was saying, it does trend with red versus blue, and a lot of this is kind of just freedom of choice. And the question is, in the face of a public health pandemic, I still think we should mandate masking and we should mandate vaccines to the extent that we can legally.
Riley, there's this thought that COVID isn't threatening to children. Is that true?
Absolutely not. And I think we're seeing U.S. health officials really change the tone and tenor of the conversation. In the early days of the pandemic, when we were seeing many older adults and immunocompromised folks hospitalized, there was this sense of, oh, children aren't as affected, don't you worry. Now the American Academy of Pediatrics, Dr. Fauci, Peter Marks at the FDA, they're out on the speaking track, really trying to ensure that parents do understand the risk posed to kids. And as the stats you put on the screen speak for themselves, 44,000 have been hospitalized since the beginning of the pandemic. We've seen 350 children aged 12 to 17 die, and including some younger. But really, we do mandate vaccines for children in the school setting that pose significantly less risk at this point in time. So as Dr. Smith says, as we see that full approval, no doubt in my mind, I think we will see states and schools at the local level begin to mandate vaccination.
And Riley, I thought what was really interesting in your story too is you sort of get into some of the ethical questions too that people are asking when it comes to a COVID vaccine and sort of the risk benefit for kids, right? Can you just talk a little bit about that and sort of what it is that some of the thought processes of the sources that you spoke to for this story?
Yeah, one that surprised me the most was this discomfort with the notion that we should vaccinate children to protect others. Should we be vaccinating kids for their own health, or is this about protecting parents, the broader community, those at the school setting, the elderly? And when we got into that territory, when it was less focused on children themselves, that's where a lot of this debate arose. And in the US, it's always going to be about personal liberty, right? One thing that really struck me was a 1905 Supreme Court decision that determined that individual liberty in the US is not absolute in the face of a public health crisis. And we do have the capacity and capability to mandate vaccination in the name of public health. So whether or not people are comfortable with that is one question, but the precedent speaks for itself.
Dr. Smith, what should parents be thinking about in the next couple of weeks as schools start to return to session, as so many children remain unvaccinated, and as the variant is spreading?
Yeah, so I think a couple things. So totally agree with what Riley just said about vaccine mandates are totally ethical, right? I have no concern about that, especially to kind of protect the greater good and public health in general. However, as we're seeing, especially with Delta, we're seeing in parts of the country where there's not great vaccination rates, children's hospitals are full with kids in the ICU. So it's not just about public health; it's about protecting our children. So that's the important thing. So I think if your child is eligible for vaccination, please start that vaccine series so they're protected once they go back to school in the fall. If they're too young to be vaccinated, I urge you to wear masks, because data that our group has done here at Duke has shown that, in the pre-vaccine era, when kids started to go back to school, masking was the single most important intervention to protect children. So I think vaccines, now that we have them for 12 to 17-year-olds, are probably the number one thing. And masking is essential in situations where vaccine is not possible in the school setting because of the kid's age.
And Dr. Smith, do we know the timeline for vaccines being approved for those even younger?
Yeah, so as I mentioned before, we are part of a group of clinical trial sites that are working on the Pfizer vaccine right now in younger kids. I know Moderna is working on these vaccines as well. We're probably looking at the end of 2021 if all continues to go well.
That's Dr. Michael Joseph Smith, the pediatric infectious disease doctor, and Riley Griffin, Bloomberg Health Team reporter. Pick up a Business Week. This is the cover story this week.